It's an overwhelming feeling to be told that you have the disease, but there's an enormous amount of hope. Unlike 20, 30 years ago, when people were extremely sick and there wasn't a lot of good treatment, now we have amazing treatments. And people can expect to live a normal life expectancy if they are able to take the treatments correctly and if the disease is caught early. So it is very much a time of hope in this field.
It's not going to kill you. It might be a chronic disease, but it's extremely manageable. It doesn't really carry the stigma that it used to carry because, you know, we've grown into a different age. It's not a disease of the 80s where everybody's rotting away and dying. For the most part, you really couldn't tell walking down the street who's HIV positive. It's next to impossible.
This test result doesn't mean that you're going to die tomorrow. It means you have a disease, you have an infection, but it can be controlled. It can't be cured at this point, but it can be controlled and you can live a normal life, but you have to come in for care and get started on medicines if it's indicated to do so.
Even if you're feeling like there's kind of no future available to you, that there's so much possibility for having good quality of life and positive relationships with others.
Nowadays, the treatment of HIV has come a long, long way from where it used to be, where a lot of people used to think that it was a death sentence if you had HIV. So now many people are living very, very many long years. I actually have a patient who's close to 80 who's been living with HIV for over 20 years. So it's basically like living with any other chronic disease like diabetes or hypertension. So it is not, you know, the same kind of, it doesn't connote the same kind of negative things as it did before. I mean, obviously nobody wants to have HIV, but if you do have it, there are certainly treatments for it. The treatments work very well, and you can maintain a very healthy life for many, many years and be just like anybody else.
What else do you feel like has changed in these 23 years?
Hope.
Yeah.
There's hope now. The medical field. Boston in general has so many resources. I believe they've identified that the stress alone of what, you know, with the stigma, I believe I have lasted this long because of my mindset. You know, I didn't feed into it. You know, I had a lot of other things going on. I didn't feed into it. This is going to save your life. People aren't dying anymore. People are not dying from this anymore. Hope. There's hope now.